I'm from the Midwest, and one of the main reasons I wanted to come to Rush for residency was finding the best technical place to train, and Rush fit that. I also wanted to be in a world-class city like Chicago. Having grown up here, it's a place I love, and I wanted to be close to family. And I knew it was an excellent academic center where I could do research and ultimately help train residents and med students and future generations. I think what sets Rush apart from where I trained previously is mentorship, the collaboration, and I think the culture here. You can pick up the phone anytime and talk to any mentor, and people are willing to assist you or help you or come up with new ideas on ways to treat a problem. So I think it's really that collaboration and willingness to help that set it apart. The thing that stuck with me most from my residency experience was the people. I formed a really tight-knit group of friends, and we're still in communication today. And whenever questions arise clinically too, I have no problem picking up the phone and calling them for advice. I wanted to have a career at Rush after residency and fellowship, mainly because of the culture. And I think it's a great place to practice bariatrics in that I have the ability to go to multiple locations. I get to do robotic surgery. I get to have residents and students where I can teach, and I get to do research that I feel directly translates to patient care. My approach to patient care is patient-centered and evidence-based, and I think that was directly learned from Rush. I think Rush is very patient-forward environment where we meet patients where they're at and tailor our care to what the patient needs. And I learned evidence-based medicine here too, where we can critically evaluate the literature, do research ourselves, and then implement that to create the best patient plan or surgical plan and ultimately get to the best outcomes. My experience practicing all over the Rush system has been really good. I think no matter where you're at, the people are amazing. They're kind, caring. They help you with your patient care, and they really care about patients themselves. And I think the other element is there's great communication across systems, whether I'm at Rush Copley or Rush Oak Park or Rush Oak Brook. I know that the details aren't going to get missed, and I have a great staff and nursing team that provide excellent patient care. I think what it means to patients to have access to care in their own communities versus having to come downtown for care, I think is very important. It is meeting patients where they're at and providing the care they need in a space where they feel comfortable and don't have to travel and put up with long commute, traffic, a busy academic center that they're not used to, and you can bring care to them and still provide the same great care. We have a great collaborative team. So for example, in the bariatrics department, we have dietitians, psychologists, medical weight loss providers, and we all collaborate together to come up with the patient plans and hopefully the best outcomes. My experience mentoring current residents and fellows has been great. I love to teach. I try to instill evidence-based practice, technical skills, and for me, I love being in an academic environment, so that allows me the ability to train future generations. They also challenge me to stay current on the surgical literature, and hopefully I can offer them opportunities as they spark my interest as well from a research standpoint, so that we can be at the cutting edge or the forefront of the field. I think it's incredible to see the transformation of patients over time and seeing how their health has improved and the difference you can make. You can literally cure diabetes doing bariatric surgery.